Hello, everybody, and welcome back to another ARPneuro Q&A show. My name is Jake. I'm your trainer for ARPneuro, and with us, as always, is, of course, Matt Dell. Good to see you here, Matt Dell. No nicknames today?
No nicknames. It's late. It's late in the year.
Past your bedtime?
It's my bedtime. All good, my friend.
I love it. Matt and I, in case I don't throw you off, Matt and I got into a sparring match, and he knocked my front tooth out, so I'm in the process of getting that fixed.
Yeah.
So I should have slipped that jab.
I love it. I love it. But I wish you wouldn't get it replaced. I like the look.
Well, I fit in with Florida Man for sure.
You look bad. I mean, you look like a badass. I love it.
We need Dr. Battaglia in here, and then I can pretend to be a hockey player like him.
There you go. I love it.
But I think he has all his teeth. I'll have to ask him. Maybe not. Maybe he's got some implants as well.
Yeah, good stuff. Well, we got a ton. I've been getting questions from friends and PRS owners all day, and I said, we're going to try to get to as many as we can tonight. So
yeah,
I think this is kind of taken on a life of its own, because we've got more and more owners of the PRS and RX that just want to make sure they take full advantage of the technology, how they can utilize it to the best of all the protocols. So I mean, these things are starting to be very good, Jake. So good work.
Yeah, absolutely. And we actually do get, we're handling questions all day. Don't be afraid to ask a question as we're going through this Q&A. That's what it's for. It's your time. So feel free to leave a message. You can leave it on this platform. You can also, if you know somebody to text to reach out, or also info@arpneuro.com. So yeah, ask away as we continue on.
Awesome. Let's do it.
All right.
Yeah, I think most people know, but for those that might be new to today's presentation, technology has been around for over 20 years, huge success rate, primarily focused on professional athletes. And now we're taking that to weekend warriors, collegiate athletes, high school athletes, and really just anybody that's trying to get either recover from injury or avoid injury. So
love it.
I mean, kind of all over the NFL. I mean, Jake is up at 5 a.m. treating players all around the league, answering questions, getting them some protocols for whatever injuries that are ailing guys that are out there battling every week on Saturdays and Sundays in football. So it's this stuff absolutely works.
100%.
Good. We've really got two products. We've got the RX100 and the PRS, very same technology. Really, the only difference is the RX100 is a Class 2 medical device that can do up to 500 contractions per second, whereas the PRS, which is much more portable, can be utilized and does up to 245 contractions per second.
Absolutely.
So here's just an example of pro athlete Lane Johnson, all pro. I don't know if you watched the game yesterday, Jake, but man, he's a stud.
I did watch the game. Unfortunate for the Eagles, but still a lot of studs on that team. So they'll bounce back.
Yeah, he was. I mean, because that 49er defensive line, they've got, it's unbelievable. And
yeah,
they were calling him out, Lane Johnson, last night as what a beast, man. He did a great job with a handful of all pro defensive linemen. But he is a huge proponent of ARP. As a matter of fact, this was an article written in a newspaper where, during the playoffs and the Super Bowl, he had a torn groin muscle and was using the RX and the ARP treatment for basically allowing him to play through the playoffs and in the Super Bowl. And that article was all about him, knowing that there was no way he was going to be able to do it without the success of this technology. So that's actually him. I think this year, I believe Colin or somebody took that picture. He was using the PRS to prepare. That's just before they played earlier in the season. So
yep, exactly.
He's both. So
and what he's doing there is he's either doing recovery or pregame, and we'll kind of talk about that as well. I know today is about the hip, but I'll cover that a little bit as well. And I also did just get a picture from Dr. Battaglia, and it looked like he knocked his front tooth out playing hockey probably years ago. So
I love it.
Yeah, just
I
kind of off the cuff there.
I don't think you could play hockey without all your teeth. I mean, isn't that kind of that's old school?
I'm sorry, that's his brother. That's his brother. But even still, yeah, it's a badge of honor, I think.
Yeah. Well, good. This is, a lot of people ask Jake, hey, what is, how does this compare to a TENS unit or some of the other devices on, how does that compare to like a TENS, a Mark Pro, some of these other technologies that are available on the market?
Yeah, and again, I'll sound like a broken record, but I'll go to the biggest thing. Our bread and butter is just the direction of the current being DC compared to AC, and that gives us the ability to go to the depths that we're able to. So when you have something like the TENS unit, it's more physiological, kind of superficial. So surface area, you're going to get muscle contractions. You probably can get to cellular level to some degree, but you're not going to be able to get it to a level where you can actually build strength. We actually have that ability. And not only that, ours is neurological. So that being said, this gives us the ability to kind of rewire those circuits, so to speak, when something breaks down or we're getting a muscle that's not absorbing force. This helps us neurologically reset that so those pathways are working the way they should. So it's a game changer, and not just the RX does that, but also if you have one of those take-home units, which is predominantly what I'm going to talk about today, the PRS also has that capability. So definitely a game changer to the against something like a TENS unit.
Very nice. Yeah, I think we're going to start seeing more and more about this as we've got universities like Kaiser and Logan who have really kind of done a deep dive. They're starting to use it as part of the curriculum, teaching students, and really starting to get some of these new DCs coming out and probably utilizing this as a modality in their own practices. So although we've got probably close to 100 clinics around the country, we're anticipating that growing leaps and bounds as these students start graduating and take this new technology into their own practice.
Correct. And this is also where we have that ability to get a lot of that research. So this is where a lot of the new protocols have been developed, and we've seen a lot of great success with that. So kudos to them, and we're excited to see some of the new things that are coming up in the near future.
Love it. Yep. Yeah, I think, Jake, you mentioned a lot of these, but, really, some of this technology, it helps alleviate pain. We've got a lot of people that either utilize the PRS or the RX and, to get out of pain. So they've got some compensatory issue and they've got a knee issue or whatever, or today is a hip issue and there's some muscles or whatever that aren't really firing. This will help fire up that muscle and neurologically kind of get it working to pull that pain away from that origin and actually, get that firing so that it'll absorb as it's intended to absorb. Also helps prevent injury. It really helps accelerate the natural healing of soft tissue, really helps increase range of motion. And again, what it's doing is, muscle conditioning and re-education.
Yeah, 100%. And that preventing injury is really a game changer, whether you are a competitive athlete or you're a weekend warrior. That's something that a lot of times it's overlooked. You don't always see a muscle that's breaking down. This has the capability of finding it before it actually happens. We've gotten so good with it these days that you don't even need to scan, but as long as you're using this technology, this is going to help keep the muscles firing up properly on time. So that way you're not getting any future injuries that you could prevent, obviously. So there's a lot of times you're out there and you end up getting an injury and you're wondering where that came from. And in many cases, it's a muscle that wasn't necessarily absorbing force, or it was mistimed, or it wasn't on time, so to speak. And usually it's not because you're not strong. So this has that ability to make sure your muscles are firing properly.
On that note, Jake, just a couple, out of curiosity, what are some of the, I know some of the craziest areas what you found. A lot of times if somebody's utilizing the technology for, standard protocols and then it's not working, obviously that's when you do a scan and find out specifically where it is. Just give our listeners a kind of an idea of some of the crazier areas where you found something not quite firing that was causing an injury or pain in an area of the body that was completely away from the origin of the issue.
Yeah, it's interesting because a lot of what we've learned recently will kind of speak to this. And there's going to be a lot of doctors that will probably relate to this even more, especially the ones that are seeing hundreds of patients a week. And we do have those doctors that are out there just kind of running a lot of this and seeing many different types of results. But one I can remember in particular was actually a shoulder injury that we weren't seeing results. We were going through the scanned a little lower, and it actually worked out to be opposite QL. That was a real major hotspot. I went with the scan. I went to QL, and the other one was medial bicep, and that happened to be that placement that made their shoulder kind of improve. The range of motion increased, the pain went away, and then that was kind of the building blocks of that shoulder actually getting back to essentially at some point 100%. Never would have guessed that the QL on the opposite side would have been a cause or some sort of indication where that shoulder was having issues. And there's more stories like that.
Yeah, I love it. Yeah, I think it just goes to show that when you're looking at these conditions here, then there's so many more. These is just a sampling, whether it's sprains, strains, tears in the knee, ankle, wrist, elbow, spine, tendonitis, having issues with limited range of motion, concussions. There's just so many things as this technology can help build. I guess it's like, when I look at it, the biggest analogy is, when you're trying to do CrossFit or you're training all the different aspects of working out, there's so much that's needed. There's not enough time in a day, and this can kind of help, strengthen those areas to prevent some of these injuries and or to recover from these. Is that a pretty good, accurate statement there, Jake?
Yeah, it sure is. And actually, it's funny, as you were talking, I actually got a text from one of our doctors, and he mentioned that he finds the VMO as a breakdown when they're working on the ankle. That's one example that he sees. By the way, he sees about 160 on the low end to over 200 patients a week, predominantly using the ARP. So he's got tons of examples of things that are just, you never would have predicted otherwise.
Good stuff. Yeah, I think, one of the slogans that we've heard and a lot of our patients have heard, it's really all about the outcomes. I think it's success begets success. So if you have an issue with an ankle or a back, or in today's discussion of how to help the hip, we've got stories and stories upon stories of people that have had success with the outcomes of this technology, for sure.
Absolutely, 100%. And we're going to get into the hip pain protocol. While that was going on, we do have a lot of questions. I'm going to start with some of them first, and then we'll get into to hip pain. We'll get into some of the other deeper questions down the road. But I want to target this one because I think we get a lot of this in the long run. I'm a first-time user and a new owner as of today. So congratulations. Thanks for being a part of it. And I'm excited to see the results you get out of it. But which leads do I plug in on the 4-prong style? I'm guessing you're asking if there's protocols for the 4-prong when you're using the PRS. And yes, there are. And I will, it kind of brings a kind of a sort of a 2-part question, because then he asks, are there videos that you can refer me to? And we'll go into that. And there are. So it will talk about the 4 lead and the 2 lead. And there are specific videos that you can actually go to. There's going to be some on our website. There's also going to be some on our YouTube channel. The website handles some of the more basic pad placements for the PRS. Very easy to kind of sort of handle it. And there's Sarah's 100% on top of it all the time. So it's right below ARPneuro.com, how to use the ARPneuro PRS. And you'll see a bunch of protocols on there. Those are some basic ones. And then I will talk about the YouTube channel where it goes into some of the more detailed protocols. I'm going to touch on one of those in particular, which is going to be hip pain. So I hope that kind of handles some of the beginning questions. As you get used to this PRS, you'll find out how actually user-friendly it is. And it's sometimes as simple as just sandwiching an area, whether it's your knee, sandwiching your shoulder, or just going to low back, and you're going to see some results. I'm not suggesting those are necessarily going to be the best results, but you're always going to see something coming out of it for the good. So good questions. And as they keep coming in, we'll handle those. But hip pain protocol is one that we do get a lot of questions for. I've gotten 2 in the course of the last 3 days. I personally have used this for hip pain. There are protocols that I feel are better than others, and this is one of the older ones that I still actually enjoy. I feel like I still get success from, even though we have a lot of the newer ones that I think are better. I still find myself going back to this one. This is why I'm going to share it. But I'll also refer to you to some of the newer ones as we're talking about it. But this is just some conditions. There are definitely more than just this, but we've seen a lot of success with these: labral tear, FAI, sciatica. Anybody who's a runner probably is very familiar with the ITBS, IT band syndrome, bursitis, impingement. I've certainly dealt with the IT band syndrome. That's a common one. One of the reasons this is so successful is it does a great job in increasing that range of motion. So one of the problems with IT band, if you're a runner, it gets really tight. And before you know it, you have lateral knee pain or you have hip pain. In my case, I used to run a lot and it would go to my hip, sometimes to my knee. And foam rolling doesn't always do it. Any type of myofascial release doesn't always conquer that problem. This does a good job as you're going through and you're handling those miles. Any questions on that? Feel free to.
Yeah, Jacob, I'd love for you to grab your friend in the back there, stretch Armstrong.
Yeah.
And, I have some questions for you. I mean, because, as people age and I'm hearing more and more about hip replacements, just kind of through stretch there, show us some of the areas and why is that occurring? Are they not strong enough? Is the hip not strong enough to actually, function, and then the hip kind of wears down and then they have to replace it, or what's happening?
Well, it really depends. And, so I'm not a doctor. I'll answer to the best of my knowledge as a strength coach.
Okay.
And so I'm more of the muscle guy. But, I will say in, sort of the FAI, it is because, that socket that goes around, it starts to wear out. And then it becomes very difficult for that to move. Sometimes also there's also a muscle breakdown. And that could be not necessarily that it's weaker. It's probably not, it's mistimed or it's just not firing the way it should. But I will say a lot of cases, when as you age and you start to go into, different activities, that there are muscles that aren't used to actually being worked, that could certainly be a problem. So, for instance, a big one is pickleball. And before you realize it, you're shifting your lateral back and forth, and you're starting to engage glute med. You're starting to engage the inside of your thigh, gracilis area. You start to pull muscles, your Achilles down there. So if they're not worked, they're certainly going to be to a position where kind of like a rubber band, where if it's been sedentary the whole time and then suddenly you're pulling at it and you're trying to like make it more active, that could create some issues. And, in any case, when it comes to muscles with the ARP, the reason why it works so well is you have that ability to strengthen the muscles, whether it's around your hip, around the knees, around any joint, like your ankle as well. You can strengthen these muscles without putting pressure on the joints. So one of the things, and it's been a long process, I think if you've been in enough of these Q&As, I often address my hip. My right hip has had issues. For whatever reason, I would say it was either FAI or maybe it was bursitis. It turned out it wasn't bursitis, probably wasn't FAI as well. Most likely it was probably a tightness in the IT band and maybe some other issues as well. But as I've worked through some of these pad placements and we've gotten to some of these even newer protocols, I was able to work these muscles without having to put pressure on my joints. That was that whole spiel was really to get to that. I didn't have to literally put a lot of weight on my back or my hips in general or my knees. I was able to just put the pads on, contract the muscles, and that's going to help to absorb the force. So it's definitely going to keep the life of your joints.
Awesome. Great answer. That actually helps. Thank you.
Yeah, absolutely. Let me get back to this. So in this case, this is a really easy pad placement here. Again, definitely not one that we consider a new one. This is pretty much one of the older ones, but very simple pad placement, black on glute med, and then red on the inside of your thigh gracilis area. Now, this is the 2-pad system. Somebody asked, I believe it was Dave, new PRS owner. He asked about the 4-lead system. You could essentially run the same thing and then just spread it out and then mirror everything on the other side. It really that simple. Now, this is predominantly for the PRS. That's kind of what we're focusing on today. With the RX, oftentimes, we will go 90% of the time bilaterally. But with the PRS, not necessary. Sometimes that 2-lead, I'll focus on just those two sections there. Now I'm going to remove this before we get into that portion, because I want to show you a few moves you can do with this. And you'll see this was about when running this particular movement, it was about 6 months ago when I was trying to work on my hip. And kind of, this is one of the movements I suggested. You can have a chair in front to help that balance. And you're just doing kind of a kickback and a side kick, so to speak. Now, based on where the pads are, you don't necessarily have to keep that leg straight. I would almost say you can even curl that leg. So bring your heel maybe towards your butt. That's going to help engage the gracilis maybe a little bit more. But I like that straight leg kickback just to sort of engage the glute as well. So that would be the first movement. I like this one because it forces you to sort of balance on that hip that's recovering. If not, it's both of them. And that's going to engage the muscles as well. But as you can see, no weights necessary other than just using my body weight and the PRS.
I got a question on that.
Yeah.
As you start kicking that out to the side, right? That's a whole different muscle that's kind of hard to work, right? I mean, it's that kind of, because that seems to be a challenge for a lot of people. Why is that? Is it just because it's a difficult muscle? See how
Yeah. So that's a great question. When you're going on the lateral side here and you're kicking outward,
yes,
not that one, but coming back to this one right here. Let me see if I can get back right. That.
Yeah, that one. Yeah.
So yeah, that's one of the reasons that pad is on the gracilis, that inside, it's basically the inside of your thigh. So if you look at, let me remove this. If you take a look at stretch here, it's right on the inside right here.
Okay.
And
that's the black pad or the red pad?
Well, I have the red pad, but the glute med is also going to help engage that as well. Okay. So a lot of people are struggling. Maybe they just have weak, their gracilis is weak, or, maybe just in general, their adductors are weak. So that's going to help that area as well. It's in the same spot, so to speak. Mm-hmm. And so as it's firing up, that's going to help that movement a little bit more. Usually when you're talking weights, one of the things that you can strain is when you're doing, if you ever seen in the gym, you have these adductor machines where you're closing it, and the abductions where you're opening it. Yeah. People should work those a lot. The women usually do. Men aren't usually as good at that. Maybe that's why my hip rotation is struggling these days. But it is getting better. So when you see some of these other videos, you're going to look at this next one. You're going to say, wow, his range of motion in his hip is horrible. I can't wait to show a new video because I have been using this and it is getting better. Good. So, but that's one of the cases there, the gracilis and your glute probably not firing properly. And we're in those areas where you're able to get through those movements, and it'll help increase that range of motion. All right, here's another one here. As you can see, look at that range, pretty terrible. But this was sort of first month really working on it. But this is a movement I would suggest doing. One of the things I didn't do in this particular video is I also didn't do what we call a mule kick, which is essentially now taking that leg and going behind you and you're kicking upward. Probably another good one you can do with that. But that the side one is also a good one. That's why I used it. Okay. And then these are all progressive. So you're not necessarily going to do all of these. It's just going to essentially be where you're at in your stages. This one's a little bit more difficult. This one's working on, more range here. We call these cars or controlled articulated rotation. Just a fancy way of just saying it's using the whole range of motion to a single joint in a controlled, mindful manner. So as you can see here, you can see where my struggle is, where I'm coming around. That knee should be in that same spot when I'm coming back, but it drops. And so there is a major issue there. You see how my hips kicking way up, my glutes going way up to the side there. So as we're using the PRS, this is going to help as I'm going through movements, increasing range of motion. So,
and again, Jake, where can our listeners find these, videos?
Yeah, I am going to get into that. I have that on the bottom. So yeah, good question. Hold that thought. One more thing I want to talk about that, before we get to that.
I was kind of already, that was it just to see if Sarah was still watching, because I thought maybe she'd pop that on there.
You just want her to put more things on the bottom.
I love it. It's all good.
So with all those moves put in place, you're looking at, my suggestion is always 5 to 10 reps, 3 to 4 sets. You can always do more. You can always add more. As long as you're not compromising your form for more intensity, we're always going to try to push more intensity. So if you can handle the intensity and you can still run through the form, keep it going. And then once you finish with that, I always recommend some sort of recovery. So you saw what Lane Johnson was doing when Matt talked about that from the Eagles. It's essentially this one black pad on the bottom of the foot, and you cross it over to the shoulder. Now you can't see it there, but black's on the bottom, red's on the top part of the shoulder. With the PRS, you're not really crossing it. So it's just going to the back of the shoulders. So essentially it will be in this location right here. Let me pull this off. So the red will be back here and the black is on the bottom. So you're essentially just running that current upward, if that makes sense. That's your particular recovery protocol. Now, there's a couple of ways you can run this. I like sensation. So you're technically going to get more blood flow in a shorter period of time if you just run a light sensation of contractions. But if you're finished with the contractions, maybe you want to sleep here, then of course you can go to that main pulse suspend, which we call that blood flow feature. I have slept with it on this before. It's pretty phenomenal. There are some setbacks, which are the cords. So just be aware of that. I always recommend wrapping it. I wore socks last time and compression shirt, so I didn't have any issues last time. So just little techniques on that.
I know what to get you for Christmas, Jake.
Thank you.
One of those onesies that that'll be body tight, and then you're gonna have cords all over.
I thought you were going to get me some more socks.
Yeah, well, I've got your socks here that I had to borrow because I forgot them on our last road trip. So
those aren't just any socks; those are phenomenal.
I love it.
They'll make you faster.
I don't know about that.
So Matt asked a great question, and some of you also asked a question. There's plenty that are up there, so I'll handle those in a second, as many as I can. But yeah, how Sarah already did it, but how to use the PRS, that's the section there. And we also have our YouTube channel. If you just go ARPneuro, it'll pop right up. And then we have on the bottom, as you can see, we have a playlist of many different things, a couple protocols. We have performance. What I do recommend is going to the actual protocols on the ARPneuro YouTube channel, because that's where it's going to go into more detail. You're actually going to find this particular hip video on that as well. So it'll go into a lot of detail that you can kind of peruse, and it'll help you for a lot of other different things as well.
Great.
There are a ton of questions here. Let's see. I'm going to pull this one up. Sarah has a long one, and I'm going to just show this. From Chauncey, I am a professional base jumper, and I have hip pain. I hike about 2,500 vertical feet per day, 4 to 5 times per week. What a stud. I have a slightly torn labrum and a cam lesion. I am trying to maximize my therapy with the machines and would love to know what to do. I noticed that I don't use my glutes when walking. So there you go. These pad placements will probably help you. So I would definitely go glute med, or you can literally just go horizontally across your entire butt cheek or piriformis area, and then maybe place that red pad on hip flexor or an adductor area.
Can you show them on your friend there stretch?
Yeah, absolutely. I dropped my pads here. So essentially, in addition to what I showed you, maybe just right across right there, red or black, it's not going to necessarily matter. Either one, you're going to get results. I usually start with a main one. If I thought my breakdown point was somewhere in my glute, that's where I'd put the black, but you can always just switch the pads. A lot of times I like to do half one and then switch it, and then, run the other side with the black. But yeah, glute med here, and then we'll pivot on the inside, and you can either go hip flexor, probably where I would go with piriformis, just like that, probably a little higher. So sort of like on the angle there, and then glute med on the other side. And if you do have the 4-pin leads, just mirror everything on the other side.
Do you suggest going 4-pin, or do you like the 2-pin for this situation?
That's a great question. And here's why I'm glad you asked it, because, you know, if you're maxing this machine out, I would stay with the 2 lead. The 2 lead is going to give you more power for that breakdown. Specifically, I use this a lot on my right hip, and I use the 2 lead because I crank it all the way to the top. The problem with the 4 lead, and it's not a problem, it's just the design, it spreads it out. So now you're getting it to both sides, which is good, but you're taking away, you know, some of that, you know, area you can actually wake up. So that's all going to depend. When it comes to an injury, I'm probably going to recommend the 2 lead for the smaller PRS. And as you get into it, and you're starting to get into some more of movements, and you're working both sides, then run the 4 lead, especially with the workout portion of it.
Good stuff.
Did I talk a lot, or is it already 30 minutes, Matt?
We're 31 in. I think it was me, but that's okay. Let's get to a few more questions. I think you were answering them quite, you know, as we were going, but jump on a few more so we can.
David, appreciate your question. I had severe pain that developed in my shoulder, couldn't lift my arm past my chest. I did the shoulder protocol on it a couple nights for 30 minutes, as high as I could, handled it at a sad 25%. Not so sad. That's pretty good. This is an intense machine, so I wouldn't be too disappointed on how high you're getting, as long as you continue to see that increase. I had to keep working the next few days. I found if I wear the PRS all day and take it to about 15%, I was able to move my shoulder all I wanted with no pain, just like muscle spasms going on the whole time. This is fantastic. I appreciate this, David. One more thing with him, he says, seems like it gradually helped in the long run, that way better than just the 30 minutes, as high as I could go. Is it okay to do? Can that build the muscle this way too, while moving around all day? All that for a very good question. So yeah, it's we used to say in the beginning, the higher the intensity, the greater the change. However, I will say the intensity depends on the patient. It depends on what muscle it's going to be on, or what muscle groups you're actually working, because certain muscle groups are going to absorb force differently. So don't be discouraged if you're not maxing this out. We used to make it almost like a braggadocious thing. It's one of the reasons I don't talk about maxing it out anymore, because I don't want to leave the impression that you have to go all the way to the top to see results. You definitely don't. I will give you a story for myself. About 2 months ago, I did have knee pain, and I'm guessing it had something to do with my hip, and I was trying to run again. And all I did was surround my knee all day with the PRS and walked around with it on a very low number, and had tremendous results, and the pain didn't come back. So you can have results just based on using it. And as long as you're using it, you're going to see some of those results. So, you know, during treatments, when you're at the clinic and you have the doctor working with you, yes, you want to push those numbers. You want to see how much your muscles can absorb the force. But at the same time, as long as you can perform the move correctly. I think what happens is people get carried away, just kind of like what we do when we're lifting weights, and we're more excited about seeing how high we can get with the numbers, or how much weight we can lift, that we're giving up the most important thing, is making sure we're getting that form correctly. We're making that range of motion increase, and we're actually working that joint or that muscle the way it should. So it sounds like you did the right thing. You clearly got results, and that's you're living proof that you don't have to get super high to see the results from this technology.
Yeah, good stuff.
Wonderful question. Dr. Neal, do you find the more intensity, the better, or keep it as comfortable for the patient? Okay. So again, similar question. Again, I will say in the clinic, I would really recommend pushing those numbers as much as they can tolerate. But, you know, that's going to vary between the patient. It's also going to vary based on, you know, where you're placing those pads. I'm not going to be able to get these pads as high on my biceps as I will on my legs, usually. Some people say I should walk on my hands. So maybe in my case, that's not true. But in most cases, that's usually going to be the case. Now, I will tell you another thing. When you put me in a foot bath, I'm not going to hit the numbers that I normally would. So yeah, push the numbers, but as long as it's not compromising form.
Yeah, it's all about the form, isn't it? And kind of working through and getting those compensatory issues kind of worked out and getting the muscles fired back up. So I think we're starting to see so much more. And I think even, as we start getting more and more scientific data that, where can somebody find some of that scientific data that as we get studies, Jake or Sarah?
Yeah. So again, that's going to be on our website. And again, ARPneuro.com. You'll see a lot of the studies there. Kaiser's pumping out a lot for us. We have some coming from other offices. So by next year, there it is right there, ARPneuro.com/thescience. And we are continuing to see a lot of great stuff. I know I brag about the middle cross a lot. I'm going to brag about it one more time because I've been using it a lot with certain athletes. And we're talking elite athletes, and the results have been absolutely phenomenal. And that middle cross is, according to Dr. DeBono, we were talking about, and I agree, I've been looking into a lot of that. It's becoming the new core. When people always talked about your core is everything, which I said that in the past, and it really is in many ways, but they're noticing it's about the anterior and posterior sling. So you start getting into
demonstrate that on stretch. What do you mean by that?
Yeah. So if we're talking anterior sling, and I'll go over those pad placements too, since we're talking about that. What we found when we were when I was working with Dr. DeBono on the research, he decided he wanted to first hit the anterior portion of it. And that's where a lot of the results we saw. So the red pad would essentially be on pec minor.
Okay.
And then we crossed it to the opposite adductor. And as you can see, it's on the inside here, opposite adductor, and then crossed over to pec minor. Now, in the beginning, we would just mirror it to the other side.
Mm-hmm.
Now, and I'm going to have to talk with Dr. DeBono on this and what they're doing at Kaiser. I know the students are working a lot with it, and they're finding a lot of great results. And I've been doing this as well. I believe with that second lead, let's just say, for instance, there was left side hip pain here on old Stretch Armstrong. Then we would, wherever the pain was at, and in my case, it was by the greater trochanter area. So I'm placing a black pad here, almost like glute med, and then over by TFL, this area right here. So I'm sort of like cupping it right around the area, that pain area, but then running this middle cross. I mean, we're getting kind of ahead of ourselves. That's more of an RX protocol. You can't technically do that as well with the PRS. But you can run this middle cross pattern with the PRS with the two leads. And to me, this is really what it's about. It's that section. And then the other one is just sort of kind of a cherry on the top.
Good stuff. Thank you for that.
Middle cross pattern. Love it. And there's more of this coming, and the results continue to be pretty amazing.
Good stuff. Well, now we're well over our 30-minute time limit, but this one fast, Jake.
Yeah, it sure did. It sure did.
Do we have any more that you want to tackle before we sign off for the night, or
did I skip any? Oh, we got another one. Here's a good one. Treating something like fibromyalgia, it seems less may be better. Yeah, I wanted to pull this one up because I was talking to one of the doctors in Jersey, and she mentioned that. And sometimes she would turn the numbers up, and she can turn them up pretty high. And she said the same thing. So I do think that certain patients are going to react differently. That was one of the cases that I noticed. And, it's a matter of, basing it on sometimes where the patient's at. And that was, that's actually a pretty good assessment of fibromyalgia.
Good stuff.
Yeah, I think if I missed somebody, I apologize. And we appreciate all the questions. So Matt, from Bob, Sarah got something up. Thank you, Sarah. Looking for pad placement for hip flexor strengthening, for CC skiing and baseball, cross country skiing and baseball, running the bases. All right. Okay, so if we're talking hip flexor strengthening, and we're, and it's specifically that, I would actually go right on the hip flexor. And if it's to also replicate cross country, there's a couple of placements I would go with that, especially with the strengthening. Maybe hamstrings would be a good one from that. I would probably go a little bit higher on the hamstring, though. As you can see here on stretch, I'm just below the crease, but I'm still going, long ways down the hamstring. But another good one for cross country would probably be either IT band or just right on the center belly of the quad, just like that. So 3 different spots. I would keep it on the hip flexor as well, though.
Good stuff.
Yeah.
Well, Jake, as we're doing these and we have a ton of new exciting training, announcements that we're going to be having in the next week or so. But, this is all an effort to try to make sure that everybody understands protocols, how to use the technology, how to get all the most benefit, whether it's from one of the clinics or a new PRS owner that we had, kind of chime in tonight. So we're very excited about these kind of open forums that we can help anybody and everybody that we can.
Yeah, 100%.
Good stuff.
So again, if we didn't get to your question or we missed it, I apologize, but you can always reach out again, info@ARPneuro.com. Chances are sometimes we see a lot after the Q&A. We try to get to as many as we can that day. So a lot of times we have the same day turnaround on those. So
and we love keep them coming because it helps grow our library for you, for all the users out there, for, all kinds of different cases that this technology can help. So
100%.
Good stuff.
Matt, do you have anything you want to add?
No, I think that was a good one. Good intro. I think we've got quite a few live Q&As coming up in the next. We're typically trying to do these on Monday night, so we're trying to get questions answered. If you've got, obviously these are taped as well, but we're just here to kind of help. And if you have any questions, feel free to reach out to us at any time.
Info@ARPneuro.com, and of course check out our website and our YouTube channel for a lot of the protocols.
Good stuff. Awesome. Good work tonight, Jake.
Thanks, Matt. Good to see you again, and thanks everyone for joining in.
All right, take care, everybody.
Take care.